Have you been experiencing pain on the bottom of your feet?
Yeah.
Well, you may be suffering from plantar fasciitis.
That's right. Now, this is a common condition. There's a number of causes for this that you may not be aware of. We're going to cover them all and get right into it. You're going to find out there's more than you really wanted to know, but it's going to help you out.
Like many health problems, we want to find the root cause of your plantar fasciitis pain and try to solve it.
That's right. And the experts have it narrowed down to three primary causes. Number one is your footwear. Maybe it needs to be changed. Number two is the calf muscle in this complex. There's some treatment for that, as well as your walking habits. Are you walking properly?
So, in this video, we're going to address why each of these things can cause your foot pain and how to fix it.
Excellent job, Mike. I'm excited.
So, problem number one, according to Dr. Ray McClanahan, who is a podiatrist, the big reason your plantar fasciitis isn't going away is probably your footwear.
That's right. If you look at the majority of footwear made, it looks very nice. However, the toe box, which is right here, is oftentimes, a majority of times, pointed like a V. And what happens is your toes get crunched up in there and they really get smushed, if you will, or compressed. And what that does, it can cut circulation that's critical and is going to cause problems without that blood flow.
So, when your footwear is too narrow, like Brad is going to demonstrate on my foot, it is going to compress your toes together. And this is going to reduce the blood flow from the arteries going to your feet that innervate into the plantar fascia underneath here. If you're not getting blood flow to that area over time, it's going to start to degenerate and not repair itself. So, this is actually known as plantar fasciosis, and that is what is causing a lot of your pain down here.
And again, I just want to emphasize that blood flow. Everyone in the medical field is so aware of healthy blood flow equals healthy tissues. And if we starve the tissues of blood, there's going to be problems. And that's what happens with plantar fasciitis.
Additionally,
More?
that problem is what causes bunions. So if you have bunions, you also want to look at a different shoe.
Well, that's another video, isn't it?
And we're getting into this next.
Okay.
So the solution for this is to find a shoe that has a wide toe box. There are many varieties, but if you look at this old shoe of Bob's, it has a narrow toe box. This is going to squish your feet together, decrease the blood supply to your plantar fascia, which will lead to chronic pain on the bottom of your feet. So first step is to find a good shoe with a wide toe box. The next thing you want to look at is the heels on your shoes. So an elevated heel like this one is going to put more stress on your calf muscles, which we'll talk about later, and a zero drop shoe will not cause these problems. Now, there's a big difference between a minimalist shoe like this and a zero drop like this. They're both zero drop. The heel and the toe are all the same height, but there's not much cushioning on the bottom of the shoe, which can be problematic for some people. So it's okay to still have cushioning underneath there. Just try to buy one that's zero drop.
Right. And if you're not familiar with these terms, it's one of those things that look it up some more so you're very clear on that. I know I just bought some shoes over the weekend, and I went to a store because I'm old-fashioned and actually had some salespeople that were very knowledgeable, and we could communicate exactly what I wanted, and they were good.
And another cheaper option that Brad has that Dr. Ray McClanahan recommends is also Crocs. They're technically a zero drop and have a wide toe box.
Yeah, and they're a lot cheaper in general. You can use them for anything. Swimming, walking through the yard, gardening, up and down the steps. You could even take your grandkids out and take your dog out for a walk. And if you step into doo-doo, easy to wash them off, throw them in the sink, wash them up, and leave them dry. You can do that 172 times, no problem.
Now, if your toes are scrunched up even when you take your shoe off, what can work is some type of toe spreader. So I have the correct toes here. These are actually Dr. Ray McClanahan's brand he works with. They're very nice. You can wear them while you're walking. Simply put them in like this, and you can put your socks over it in your shoes, and it'll help keep them spaced out.
There are other toe spreaders you can buy. Then they're larger. They'll spread a little bit more aggressively. But because of their size, you cannot wear them comfortably in a shoe, and that's okay. You can simply stretch them out, wear them around the house with, bare feet. And I think that's what Bob's wife is doing, and she's having good success with that.
And my dad, who is 69 years old, is also doing this, and he's having great success as well. He has a really bad bunion, but doesn't bother him anymore.
Really?
Yeah.
Did he use this kind, or did he use a big one?
These exact ones?
Dr. McClanahan.
McClanahan.
I'm sorry, Dr. McClanahan.
So the second common cause of plantar fasciitis is tight calf muscles. So Brad, you want to explain why?
Right. So the calf muscles are absolutely directly connected to the plantar fasciitis. And I'll explain that with this little demonstration. The black tape represents the plantar fasciitis here. I have it cut off here, but it actually goes up a little farther across the foot. Now it connects up directly to the heel, and the calf muscle connects up directly to the opposite side of the heel or the calcaneus bone. So when you stretch this, if I go like this, not only am I stretching my plantar fasciitis, but I'm stretching that calf. If this calf muscle or this whole muscle tendon unit becomes tight, direct influence on this plantar fasciitis tissue, it's going to be a problem. So we stretch this, loosen it up, give some freedom to that plantar.
Yeah, so when that calf is tight, it creates the plantar fascia to be tight, which eventually can cause some micro tears in the area down there. If you're chronically having these micro tears, it's going to become inflamed, which eventually results in plantar fasciitis.
Yep, and that's where that continual month after, week after week, month after month pain can result, and people just get so frustrated and actually depressed.
So we're going to give you some solutions for that. So the first solution, like we mentioned earlier, is to get a shoe with zero drop. So what that means is the heel is the same height as the forefoot. If you look at this shoe, the heel is elevated. This is how most shoes are. Brad's going to demonstrate how this affects your calf muscles here.
Right, so if we look down here, the shoes I'm wearing are zero drop. So I'm going to put a little block there to simulate if I had a normal pair of shoes elevating my heel, half inch or so. And the tendon right here, or the calf muscle, you can see is on slack. Okay, and it'll start to tighten down that way, which puts pressure and tightness all the way to the calf or to the plantar. Now, if I pull that out and put my zero drop shoes in, watch what happens right here to that tendon. Things pull up and they tighten. So you get a little bit of a stretch, and that's going to eliminate that chronic tightness just from walking around with a zero drop shoe. And that's without doing stretches. So it's kind of a easier way to, sorry about that, to stretch it out. I get my cameras mixed up.
Okay, the second solution, if you have tight calf muscles, is to wear a night splint. So you only wear this at night when you are in bed, or I guess if you're laying down for a prolonged period of time, you can as well. So when you sleep commonly with your bed sheets on, however you sleep on your back, stomach, or side, most of the time you sleep like my left foot is here. It is pointed down like that. That is going to put more stress on the calf muscles and possibly cause plantar fasciitis over time.
You know, I don't want to interrupt, Mike, but I do want to mention if you have symptoms of getting out of the bed in the morning and you experience this, oh, and it hurts like crazy, those first few steps, and it works itself out after a few steps or a couple minutes of walking, then the night splint is more indicated, and I would recommend that. We've had people have good luck with this if that happens when you get out of bed in the morning.
So what you do is you just put the night splint on. You get it in a position like this. It's not super tight. I'm not stretching right now. It feels comfortable, but it's going to let me prevent from going down like this. My foot is always staying in a neutral position, keeping that calf muscle in this area not being overly stretched when it's plantar flexed like this. So this can help relieve some of that tight calf muscles. And the good thing about it is you just stretch it while you're sleeping.
Yeah, it's easy. You find this pretty comfortable because this is yours.
This is mine, yes, because I have a tight calf and ankle muscle I wear. You're going to start slow, build up. I commonly put it on when I fall asleep. If I wake up in the middle of the night and my calf is really tight and bothering me, I'll take it off for a while, and then maybe I'll put it back on later. Otherwise, you can go to bed without it. If you wake up to use the restroom, put it on then. I personally found when I'm sleepy like that, I won't put it on. So I put it on right when I go to bed each night.
So having it on for half the night is a lot better than
nothing at
all. And eventually maybe work it up to the full night. So
yeah, over time. Sometimes I can wear it all night long, doesn't bother me, but sometimes it's a little problematic.
Are you having success with your treatment?
I'm having some success, yes, but it takes a while.
But again, yours is not plantar fasciitis.
Mine's not calf related. Mine's an ankle injury.
Yeah, that's a different story. All right, now the third thing to address is your walking style, or we call it gait in the therapy world. And this is something that's not hard to do with short increments, but it takes a while to form this habit. It's going to take stress off of your plantar fasciitis, your calf muscles, actually your joints and your hips and your back as well. So it's just generally a healthier way to walk. We call it walking with a soft knee. First, we're going to show the typical way people walk. It's called a heel strike. Mike, can you demonstrate? Okay, now when you walk forward, typically the ankle comes up. We call that dorsiflexion. The heel strikes first. The knee is fully locked out. And what happens there, there's a lot of impact right there that goes all the way up to the joints, taking stress on the joints as well as the plantar fasciitis and the heel or the
Calf
complex
muscles.
calf. Thank you. Boy, I was stuck there for a second. Now, how you want to change that is go ahead. We're going to swing forward in your forefoot, not your toes, but your forefoot. Now, Mike's exaggerating here a little bit. When I walk like this, I kind of come down. There isn't much there, I think. At least that's the way my mind sees it. I should take a video of it. But the forefoot accepts the weight. There's a little give there. It's not like your heel banging into the ground. And look at the knee, slightly flexed. And that takes that impact off of the hips and the joint as well as the whole leg. So when we say soft knee walking, that's how that got its name, but everything else here happens. Mike, can you demonstrate with a typical heel strike for a few steps? Why don't you back up a little bit so we get it in the camera. And heel strike, and this is typical. If you think about that heel striking into the surface, particularly a hard surface, that's going to take its toll, and it does take its toll on people's joints, plantar fasciitis, hips, back, etc. Now demonstrate the proper soft knee technique. Whoa, it's soft. It's soft.
So, and when you do a soft knee technique or walking on your forefoot, you're going to have to take shorter strides or distance with each step. It feels a little awkward at first to get accustomed to it, but over time you'll start to get acclimated. This is much easier to initially try barefoot or maybe some slippers in the house versus a normal shoe. If your shoe still has a tall, elevated heel, it's going to be kind of problematic yet.
Now, if you do have plantar fasciitis and it's painful, try walking like this in your house, and you're more than likely going to experience walking normally, painful, walking with the soft knee. Oh, sorry, the soft knee, as we just demonstrated, will reduce the pain. Then you know you want to continue really to work on that change in your gait or your soft knee walking. All right, as I mentioned at the beginning of this video, we were going to give you a lot of information, and we did, and we're taking it from Dr. McClanahan. He's an expert at it. So you may not want to do all of these solutions, but pick out a few, but work through them. They're going to work out for you. So we want to get you back on your feet. No pun intended. That didn't go, did it?
Not quite. Anyway, if you want to find more resources from Dr. Ray McClanahan, we will link some videos we did with him in the top comment there. We had one on plantar fasciitis, a whole podcast on all sorts of feet problems. And we'll also link his website, which has good resources if you want to read more information about your specific problem. He gets much more detailed than us on
Right.
this.
But again, he knows what he's talking about from years of experience with his patients and personally. It's a great
Yes.
story.